Order. Before we go to John, who is scheduled to be our 1 o'clock, there was something on F9 that I needed Tim to go over and it was missed.
There was one item that I forgot to add to the F9, which was the possible statutory changes for consideration during the 88th special session. Since I've been here, I've had a lot of questions about the insulin bill from last session. Debbie, the day supply that we've all thought was probably not exactly the intent. We wrote the rule exactly as the law was passed, but 562.0541 might be one that you want to look at. We would love to have some clarification on exactly, is it package size, is it day supply? And that has nothing to do with us, but we wrote the rule as we were supposed to according to the way it was introduced. But that was one that I meant to have on that list, and I forgot it. That's my fault.
All right.
Thank you.
With that, we'll go back to the agenda, and we're going to go to H. So we know that there are a few things that we'll have to go back to, but these were scheduled. So I'm going to turn it over to John to start the disciplinary orders.
Madam President, thank you. We're looking at two items, H 1.1 and 1.2, regarding Light Care RX and Lila Alahan Boragini. And looking at both of those, I'll tell you that on March 1st, 2022, a proposal for decision was issued by an administrative law judge, or ALJ, of the State Office of Administrative Hearings in the matter of contested case of Texas State Board of Pharmacy versus Light Care RX and Lila Alahalan Boragini. For procedural history, Light Care RX holds pharmacy license 32609, and Ms. Alahan Boragini holds pharmacist license 64241. The ALJ found, by the preponderance of the evidence, that Light Care RX and Ms. Boragini, the PIC, as the pharmacist in charge, had violated the Act and the board's rules because the pharmacy failed to operate within 6 months of licensure. The pharmacy failed to conduct regular and routine business. That's what the ALJ found. At the hearing, board staff presented evidence of the pharmacy only dispensing and receiving a small number of prescriptions within the first 6 months of licensure. An expert testimony from compliance staff found that was not enough to constitute regular and routine business, which is required under the rule, and that's 291.11. And the ALJ agreed with staff. Consistent with the ALJ's recommendation, board staff is asking the board to issue 2 board orders. First, for the pharmacy's license, a $3,000 administrative penalty, and second, a $1,000 administrative penalty for Ms. Alahalan Boragini as the PIC. Both of which are set in Board Rule 281.65. And this is also consistent with the recommendation of the informal conference panel that heard this case prior. Again, board staff has prepared 2 board orders reflecting these recommendations, and staff urges the board to adopt those orders.
At this time, do we have any questions for John? Do I have a motion to approve?
Well,
I'm sorry. Oh, I'm sorry.
I think we have Ms. Alahan Boragini is going to speak.
All right. Please come forward. I didn't see anybody but the regular people, so I was like,
We're sorry.
yes, did not mean to bypass you. So if you'll introduce yourself, but make sure you turn the microphone on.
Good afternoon, ladies and gentlemen. I'm Leila Elahian Boragini. I'm the pharmacist in charge for Light Care RX since May 2019. Regarding this hearing, I should say, since I started as a PIC at this pharmacy, I have done everything in my power to run the business, bring the business to the pharmacy, calling doctors. We had customers that comes in, but the problem that we had at the time is like because we were located in heat zone, and we had to wait for PPM's credentialing for, I don't know, a long time really. We didn't have insurance, no Medicaid, no Medicare. We were following up with them, and it was like, you're located in heat zone, you have to wait. And so basically, we were not able to process any prescription because I can say like 95%, at this time, 95% of our customers, like people that are on Medicare or Medicaid or both. We have right now we have like a very few cash customers and very few like commercial plan customers. And to be honest, with the owner, we did everything, to fill the prescription because we know that we have to. We wanted to bring business to the pharmacy. That's the main point. But we were not able to do that. And we even offered our customers that were coming, okay, we can give you like a very good cash price. But they had insurance. They didn't want to pay, for the prescription as a cash because they wanted to use their insurance. So that's the whole story. That's the reason we couldn't fill. Right now, we have a very successful pharmacy. We're filling like 100 scripts per day. And I don't know if, I think if we had like 2 more weeks before this inspection, we were not here. That's all I need to say. Thank you.
Do you have any questions for our PIC? All right. Thank you so much for your
Thank you
time.
so much.
And again, sorry I didn't see you back there. All right. What is the board's pleasure? I'll throw it back to the board. I know, but I want to make sure that that still stands.
Well, I'll make the motion we proceed with the fine and
All right, so we have a motion.
Second.
We have a second from Daniel. All those in favor?
Aye.
Any opposed? Thank you, John. Good.
All right. Madam President and board members, the next pair that we're going to look at is H 1.3 and H 1.4 that regards patient care pharmacy and Mr. Jacques Washington, the PIC. On March 15, 2022, a proposal for decision was issued by an administrative law judge, or ALJ, from the State Office of Administrative Hearings in the matter of contested case, Texas State Board of Pharmacy versus Patient Care Pharmacy and Jacques K. Washington. For procedural history, Patient Care Pharmacy holds pharmacy license number 27193, and Mr. Washington holds pharmacist license 46648. The ALJ in that case found by the preponderance of the evidence that Patient Care Pharmacy and Mr. Washington, as the pharmacist in charge, had violated the Act and board's rules because the pharmacy ceased to operate for a period of 30 days or longer. And this is Board Rule 29111 again. At the hearing, board staff presented evidence of the pharmacy not being open for multiple visits by board compliance and enforcement staff, and evidence of minimal dispensing of prescriptions, along with expert testimony from board compliance staff that dispensing did not constitute regular and routine business for a period of 30 days or longer, and the ALJ agreed. Consistent with the ALJ's recommendation, board staff is asking the board issue 2 orders. The first, for the pharmacy's license, a $3,000 administrative penalty, and the second, a $1,000 administrative penalty for Mr. Washington as the PIC. Both of these administrative penalties are set in Board Rule 28165, and I will tell you that this is consistent with the recommendation of the informal conference panel. Board staff has prepared, again, 2 board orders reflecting these recommendations, and staff urges the board to adopt those orders.
Is Mr. Washington here? Before we go.
I do not believe Mr. Washington is present.
All right. Any questions for John? What is the pleasure of the board?
I make a motion we adopt these orders.
All right, we have a motion. Do I have a second? I have a second, Mr. Tisch. All those in favor?
Aye.
All those opposed? All right. Megan, would you like to go ahead and do H2 and just finish these out?
Sure. H2 is a report on all of the orders that have been entered by, let me back up on that one. Amy sent you the information associated with the items under H in a link. The information has also been put on your laptops. There was an updated chart that was put on your laptops over lunch. It's not a major change, but in case you were wondering, there was an updated chart that was put on your laptop. They're all of the agreed board orders, default orders, and remedial plans that have either been entered by the executive director or are being proposed to you. H2 is a report on all of the orders that have been entered by the executive director. These are the ones that you have authorized the executive director to enter. This item does not need a vote and is just for your information. And so if you don't have any questions on those, we can move on to the next items. H3 and H4. H3 are the proposed agreed board orders and default orders. H4 are the proposed remedial plans. These include both orders and remedial plans resulting from informal conferences and those proposed by mail per your previous instructions. You'll notice for the orders resulting from an informal conference, the chart indicates the board members that were at the informal conference. If you participated in the informal conference, we would automatically recuse you from that vote. And unless you have any questions on these, we would need a motion to approve the proposed agreed board orders and default orders and the proposed remedial plans. So that's both items H3 and H4.
Are there any questions for Megan? Rick has made a motion that we accept these board orders.
Second.
We have a second from Daniel.
So that will include items H3 and H4? Okay.
That is correct. We have a motion and a second. All those in favor?
Aye.
Any opposed? All right. So passed. We'll go back up in the agenda to item F12, which Megan will cover for us as well.
Okay, so this item is regarding PMP reporting requirements. And as you remember, or you may remember, the PMP program was recently audited by the State Auditor's Office, and the audit report was received in December 2021. The report noted that TSBP should strengthen our processes for following up with pharmacies not submitting information as required, not later than the next business day after completely filled. The SAO recommendations included that TSBP should implement monitoring procedures to monitor pharmacies to identify inconsistencies in data and bring into compliance delinquent pharmacies. As a part of this process, the PMP program compares a pharmacy's dispensing download to information reported to the PMP to verify that the reporting is being done as required. Section 481.074Q of the Texas Controlled Substances Act requires that a dispensing pharmacist send all required information to TSBP not later than the next business day after the prescription is completely filled. The Texas Controlled Substances Act does not define completely filled, so the board clarified in section 315.6A of the Texas Pharmacy rules that a controlled substance prescription is required to be reported to the PMP not later than the next day after the prescription is dispensed. The Texas Pharmacy rules define dispense in the context of a community pharmacy as preparing, packaging, compounding, or labeling for delivery a prescription drug or device in the course of before you today.
Thank you, Megan. Mr. Frost?
Hello, everybody. My name is Patrick Frost. I'm very glad you allowed me to speak to you. 37 years as a pharmacist. I've never been to a board meeting. It's kind of exciting. A little nerve-wracking, but kind of exciting. Table printed with a dispense date, and it takes 4 days for the patient to pick it up. Do we report it before the patient picks it up? And if you follow the Texas Pharmacy Act definition of dispense, it includes the practice of pharmacy. That's all these in the middle here. All these things have to be done or you do not have a dispense. If the patient never picks up the prescription, there is no dispense. So my pharmacy got picked on because we're an outlier, not because we do a lot of narcotics, because we do very few narcotics. We dispensed, I think, 11 last month, and I think it was 21 controlled substances in March. We don't report until the patient picks it up. Otherwise, you have false data in your PM. We're done. The definition of pharmacy, of dispense changed over the years. In the mid-90s, OBR came in, all the stuff. So the definition of dispense today is much broader than it was when the dispense state regulation came in. So how do you reconcile this? I'm not asking you to reinvent the wheel. I think the legal term is precedent. Under counseling laws, excuse me, counseling logs, if I fill it on January 3rd, you will accept a counseling log on January 6th. And that's the same thing here. You have to have leeway for the real world. And so that's the tech types it, it's filled, our computer on the final check, it shows an image of the written prescription or the e-scribe. It shows, a picture of the tablets and what is typed on the label. And that's where we do the final check.
Okay, so you do both together.
We discussed this one somewhat item. That's when it went to PMP. Where was
No.
that? Because I wondered if that triggered, because there's a lot of prescriptions in these bins all over the state that are still sitting there. And we as a pharmacy we look at PMP and we say, they got, your pharmacy. But it says on PMP that it was dispensed to them.
So,
Is that-
so Donnie, what happens when it's still laying in that bin and it's not reported yet? And then 2 days later, they go somewhere else and fill it, and they pick it up that day, and it's reported. Now they've got, let's say, 40 days worth of pills that they've gotten over 2 days because we didn't report the first one. Mr. Frost has called our agency and talked to, I think, four different groups. He talked to the Q line, he's talked to Linden, PMP, he's talked to Megan, and he's been given the same answer from all of the different groups at the agency, which is it needs to be reported once it's filled. When he dispenses it, we don't have control of that, but if he fills it on a Tuesday and then it's not picked up till the next Tuesday and they fill it somewhere else on a Friday, then they're getting a every how many day supply on Friday and another one that was filled the Tuesday before because it wasn't reported the next Tuesday. So we've got to have it reported right after they fill it. If it's not reported after they fill it, then he says when it's filled. Now it's the law that if it is put back on the shelf, you've got to get that corrected in the system. But it's got to be consistent, and our consistent message at the agency has been very clear that once it's filled, it's got to be reported within the by the next day.
Could I address that comment? First, in 2016, I called what was then called the compliance office, and I asked them, what does completely filled mean? And they said, well, we don't know. So I asked, is it okay to report when they pick it up? And I was told yes. When this all started back in January here, I called what is now the rules line, and I asked them, is there any requirement in the law to report based on dispense date? And they said no. The dispense date is a very specific time in a process. The dispense is the process. The dispense date is one specific point in that process. So if the law says dispense, can you change it to dispense date? I don't know, I'm not a lawyer, but you haven't yet. It still says dispense. And your rules say dispense.
So an issue that was identified by the state auditor's office is when you take a prescription and you see the dispensing download and the prescription label, those have dispensing dates. And those dates are not lining up with the PMP dates if you're not reporting on that dispensing date. And so you have conflicting information, and the state auditor's office wanted us to make sure that that was corrected.
So, and what started this was on January 3rd, I filled a prescription for a controlled substance. It was picked up on January 6th. I reported on January 6th, and with a dispense date of January 3rd. That's, the state board is not looking at, in my reporting, the state board is saying, you have something for January 6th. And they're saying there was nothing reported, because I don't have a 0 cent report, because I reported something, but there's no dispense for January 6th.
Yeah, I don't think that was the question, was the fact that there was no reporting. As Megan said, it was found as in one of our audits as a deficiency on our part, that fill dates, the date that it was processed and filled wasn't matching the report. And so that's where we're trying to come up with educational, a process so that we're reaching out to educate pharmacists and pharmacies so that they match up. And to give you like a really, to go back to your, you know, and maybe exaggerate your example a little bit more. So say you have somebody that, you know, is going to a physician that's part of, you know, he's a pill mill doc or whatever. And that doctor issues that person 3 different prescriptions. They could, in essence, go to 3 pharmacies because there's no fill history in PMP. Each one would fill all 3. If you're waiting until pickup to check and dispense, none of those would be recorded based upon what Mr. Frost is asking until they picked them up. And by that time, it would be too late, and 3 pharmacies would have filled 3 prescriptions without having the knowledge. All of these are controlled substances. That's by definition.
Well,
Could I address that?
So what you're describing is a loophole that try to keep it consistent.
Well, it's the loophole's not there if each one reports on the date that they filled it.
Actually, that's not true because we don't have real lifetime reporting.
Correct.
If I fill it on the 4th, I report it on the 5th, the PMP people tells me it takes 2 or 3 days for Bamboo to update their records. So you still have that same risk right now. I don't know, because I actually called them and I said, did you get my report that I did yesterday before we knew what was going on? And they said it takes 2 or 3 days for me to get the report. So I don't know how long it takes Bamboo. I can't swear it's 2 or 3 days, but even if it's 12 hours, they still have 60 hours in there they could play that same game. And the point is, I don't suspect everybody's a criminal out there until they prove to me they are. They may get away with what you're saying, but it'll be one time, and next month everybody will see what they did.
I think the scenario you're bringing up this process has a little more risk involved than doing it this way. You're not going to get 100% of the risk removed in the situation you just stated where there's some delays in reporting. There's less risk, though, in how it's being defined, the way we're defining it here. I can understand the ambiguity and the confusion, because it is confusing to look all the definitions. I totally get that. But now that Megan's staff has clarified what they mean, is there an issue going forward that we can go this way? Is that going to be a problem for you?
Well, I follow the law. So Ms. Holloway's great at her job, she's a good lawyer, but somebody may replace her who has a different opinion than what she has, or Mr. Tucker. This right now is an interpretation of the law, not the law. So I am asking y'all to follow the law, as written, as passed by the legislature, as signed by the governor. That's what I'm asking you to do, and that's what I feel like I am doing.
And if I may say, the agency is following the law, and we are doing education. Our PMP is doing education, not punitive. So all of you as board members need to understand, this is all educational. Everyone else that we've called has said, oh, I didn't mean to be doing it the wrong way. Yes, I'll get that corrected. Yes, we'll do it. Mr. Frost took issue with that. That's why he's here before you today. We are following the law, and PMP, after Megan and I are gone, are going to do it the same way that we're doing it today. We expect them to report within the same day or the next day every time.
Okay, so all you people with chain pharmacies who've had 10,000 or 20,000 pharmacists and technicians who are going to put back a prescription was never picked up, the state board has no way of knowing whether you take it out.
If they were not telling the PNP, they would be in violation.
I agree, the law says they have to, but you're tracking people who are not reporting, and you're not tracking people who are not taking out. So in March, when I filled 21 controlled substance prescriptions, there were actually 22, one was never picked up. It was never reported. And it's a pretty complex procedure to go into the Bamboo website and edit a prescription. I work in a pharmacy with perpetual inventory, and I have 3 employees, counting myself. Anytime something expires, they need to hit like 4 buttons on the computer to adjust the quantity on hand. I can't get them to do that. How are you people going to get pharmacists when they're putting something back, or their tech is putting something back, and they don't even know what's going on?
I honestly do think that though, each organization has a different process for that. It's not done probably at the store level or whatever, okay? But what I think the important point is that the education that the PMP is trying to give is that this is what they're looking for. You know, whether we can say it's not clear on the definitions and whatnot, this is what they're looking for. Now you could say, like you stated, we could change everybody and interpretation changes. I mean, I don't know how we adapt for that. Right now, as it stands, we're looking at, this is what they're saying, the education, what they're looking for. And I think that's, if we could adapt to that, I think we'll be okay. But I think they're just trying to educate what they're looking for. Right?
Yes, but what they're looking for is different from what the law states. And that's what the problem.
Interpretation. That's your
The law says
interpretation, though.
dispense, and it defines dispense. Dispense means prepare, package, compound, or label in the course of professional practice a prescription drug or device for delivery to an ultimate user or user's agent under the practitioner's lawful order. So what does under professional practice mean? They define practice of pharmacy.
But it says
Is counseling required when I dispense a prescription?
to deliver, but not
To dispense.
to dispense.
The practice of pharmacy, dispense refers to the practice of pharmacy.
Dispense, it says dispense means to prepare, package, compound, or label, and then it says, comma, in the course of professional practice and under a practitioner's lawful order. It does not say dispense means the entirety of the professional practice or the practice of pharmacy. It's saying in the course of professional practice, these
Right.
things that are listed above.
And I agree.
And counseling's not listed above.
But counseling is listed under the practice of pharmacy, and it says in the course of, you have to do practice, you have to do the parts of practice of pharmacy in order to dispense the prescription. And if, bottom line, if the patient doesn't ever pick up a prescription, there is no dispense. Does anybody disagree with that? So why would you?
dispense? There wasn't a delivery.
There wasn't delivery.
Okay, you reverse it.
Yeah, but you reverse it out and there's no dispense.
You reverse it out and there's no fill. So I think that it's, I think that we, and jump in, or let me know if you want to clarify this, but we have a legal definition here that we're following. And so, I mean, you're like me, you're a pharmacist, our attorneys, and we have a great group over there, do an exceedingly great job of letting us know what that law is. And it's our job to protect the citizens of Texas within the constraints of that law. So, I know you disagree, but at this point, without a change in rules, I do not feel like there's anything that we can do unless someone sees that differently. Agree with how how that is defined.
So you're saying counseling is not required when I dispense a prescription?
Counseling is required when you deliver the prescription.
So for delivery, which is part of the dispense, preparing it for delivery includes counseling.
You're getting into semantics here.
I agree. The whole thing is semantics. You know. So,
So-
is it
Now that
impossible?
you have clarity, does this help?
Well,
Now
but I
moving
don't think-
forward,
no, I
instead
don't-
of going back,
I don't think you clarified. So,
but we
is,
just gave you clarity on what needs to be done.
okay, so can the board just change your rule that y'all wrote, instead of saying dispense, say dispense date? Because that's a very specific time. Dispense is more than the dispense date.
The rule already says after the date a controlled substance prescription is dispensed. So the date a controlled substance is dispensed is a dispense date.
Not in the process of dispensing them. So, if anybody here ever worked a pharmacy and you had to order a controlled substance, the pharmacist may not have even looked at it before 2 days, and then he realized, oh, this is the wrong strength, or this is the wrong quantity. I don't understand why you want the information that is erroneous out there and hope somebody's gonna correct it.
Are you an attorney?
No,
Okay,
my wife,
all
my
right.
wife thinks I
Well,
should be.
Well, I'm just saying that we have the experts that
Mhm.
have stated the law, and so I'm just saying, I don't, you're kind of
You're getting,
fighting the wrong
yeah,
war here.
you're getting kind of in the, as a lawyer, I am a lawyer, you're getting in the weeds of trying to interpret law that benefits where you're coming from. And obviously in law that's possible, but in this case, it's pretty clear on what is needed and what is asked of. And my question to you is, what is the issue of just reporting it the day that is specified in the rule? Is there an issue for you to do that?
It's more complicated for me to prepare that sort of report. ComputerRx is my software vendor. They do it based on pickup date, because our computer is tied to our cash register. We know when it's picked up.
So this is a burden for you to do that?
It's more complicated, yes.
Do you use TDS Clinical?
TDS owns ComputerRx, I believe.
Okay, so they reached out to our agency for clarification on the reporting requirements, and they said that their users can report based on the date a prescription is entered into the pharmacy management system as filled. So there's a way to report
There
for
is a way.
that.
It's a little more complicated, but there is a way, yes, there is a way.
Did you have a comment? No. All right, so there's really no action that needs to be taken on this. It was for Mr. Frost to come bring this to our attention and for, Megan to be able to explain and clarify the rules, so.
So you're not gonna change the rule, am I understanding that correctly? To clarify it exactly?
That's correct. That is correct. Complication.
Nothing I could do.
We do appreciate you coming, though, and we appreciate you bringing
I
it to our
appreciate you at least
attention
listening
that
to me, and thank you for hearing me.
You're welcome.
Thank you.
All right, next on the agenda is F13, and Lori's gonna give us a report on the Opioid Regulatory Collaborative Summit that she attended.
So I recently had the great opportunity to attend the Opioid Regulatory Collaborative Summit at the National Academy of Medicine Keck Center in Washington, D.C. on March 7th and 8th. You all may remember in the February meeting, Tim kind of put out the ask of anybody who's interested in attending this, and I have some real personal reasons why I'm very interested in opioid safety, so I am grateful for the opportunity to attend this. This was a collaboration of regulatory boards from pharmacy, medicine, nursing, dentistry, and physician assistants. And there were probably about 150 people in the room, and it was really with the purpose of trying to figure out what we as professional boards can do to really, not remedy, but to make an impact on the opioid epidemic that's plaguing the country right now. And there's one piece of data that just was really paralyzing to me when it was cited. And it was that from September 2020 to September of 2021, there were 104,288 deaths associated with opioid overdoses in the U.S. And that was an increase from 15.9% from the prior 12-month period, and higher than any 12-month period in history. And so, you look at that and you think this is a serious problem. This is a cause of death that's exceeded a lot of those other common causes of death. The purpose of the summit was really to come up with some goals to see how collectively, as we as regulatory organizations, could make an impact on this. And so there were a number of things that were identified as real areas that we need to work on. Reduction in stigma of substance use disorder and mental health diagnoses in general was deemed to be the number one area where, as regulatory boards, we needed to make an impact. Improving access to care of substance use disorder, supporting medication treatments for opioid use disorder, and then there was the need to champion really collaborative efforts in the legislative arena around this. Incidentally, there was a lot of discussion about how telehealth through the pandemic had really really been demonstrated to be very, very beneficial. And so there was a lot of discussion on how access to treatment of opioid use disorder could really benefit from extending telehealth opportunities. At the board of pharmacy level, there were several things that we were kind of all charged to think about and to take back to our boards, and I just want to quickly go over those with you all. First was to educate board members about medication treatment for opioid use disorder, publicly endorse medication treatment of opioid use disorder, advocate for training of prescribers in professional schools and residencies about opioid use disorder, establish a CE requirement about medication treatment of opioid use disorder, and then really ultimately to ensure that healthcare professionals with opioid use disorder have access to treatment. So it was a great learning opportunity for me. It was a great opportunity to collaborate. It's hard to imagine really where we get started. But I think where we get started is getting bodies together who could potentially impact this, get the conversations going. The next step in this was really deemed to be each of the organizations that were involved taking work back and looking to see what needs to be done really to get some of these things off the ground, as well as to include other stakeholders, things like payers and educators and other people who really can impact all of these things in the conversation. So it was very preliminary. But again, I was very grateful to be at the table and have those discussions. If anyone, I know as healthcare providers, we all are very cognizant of the opioid epidemic. I have a couple of references that I'd be happy to share with anybody if anyone is interested in learning more about it, really substance use in general, and then going on to how it affects healthcare professionals. Anyway, it's just a great opportunity. I would love to further work in this area if other opportunities come up, and I would love to answer any questions you all might have or any ideas for collaboration that you all have about this.
Well, thank you for going, and what a kind of great report.
Thank you. It was a great opportunity.
Hey, Lori, you have a book called The Opioid Dilemma, or?
Let's see. I mean, I have it in my bag right now.
Okay.
It's called Understanding the Opioid Pandemic,
Okay.
I believe.
Would
I'm
you
happy
send-
to share that
Would you
reference.
send us, to Tim, the reference of that, so he can
Sure.
send all that to us, so we can get a copy of that?
Absolutely.
Okay, thank you.
Absolutely. I think it's a great read, and I think everybody could benefit, regardless
Not
of
just
your
professionally,
knowledge of
but,
healthcare.
yeah,
Just from learning more about what's going on.
right. Thank you.
Thank you.
Could I add
Yeah.
a comment or question? It's great stuff you're doing. I appreciate you going, representing. We have this opportunity with naloxone with our pharmacies, and several studies have come out showing that patients do have a difficulty receiving it in our pharmacies, even when they are qualified and should get it. I think we could think about some education along that. It's kind of a afterwards, obviously, but having it proactively is what I think is important. So I don't know if you have any thoughts on what we could do to re-educate on naloxone use. Did y'all talk much about?
Oh, we did. And different states have different regulations pertaining to that. But certainly everybody's, I think, ultimate goal is promoting the readily available naloxone for patients their loved ones, you know, not just emergency medical providers, but really people having it available in the home. And as you said, sometimes we make it more difficult than it needs to be for them to have that.
I think it's a stigma.
It is a stigma.
You know, and it's a stigma on both sides. You have
Yes.
pharmacists that are, you know, really
They
good.
don't wanna label somebody.
Yeah, well, no, even if pharmacists are really good about educating and having the conversation, and patients that go, oh no, you know, that's not me.
I don't need that.
And then you have the opposite, you know, where, you know, the pharmacist is afraid to even start the conversation. I believe that Arkansas now has a rule in effect that if you dispense an opioid above the 50 MMEs, you have to have a naloxone that goes with it unless you've documented otherwise.
At least attempt to get it.
Yeah.
I mean,
So-
you can't fake somebody taking it.
So there are some strengthening of some rules that way, but
You know, and so much of it just comes with awareness, and so while it may not be a rapid response, as rapid of a response as we'd like to see based on, you know, the severity of the epidemic, I think it is, you know, the more we can do to talk about it, to reduce that stigma, it's only bettering society in doing that, and so it may not be a quick response, but I think anything we can do to move in that direction.
And just as a resource, TPA has standing orders that are available for pharmacists. So, you know, go to the TPA website and, as a TPA member, go to the TPA website and, you know, if you have people in your communities that need those standing orders, they're available through TPA.
And Tim, we could send you maybe for y'all's next newsletter that y'all send out reminding
That's a-
pharmacists, because you don't have to be a TPA member to have access to that standing order. And some, you know, in all settings, be it
Yeah.
some chains, some community, others pharmacists that use that. And I do think you're absolutely right. People don't remember that that's there, and we have that available, so they could just easily dismiss naloxone.
And I think every setting has kind of different actions that they're taking. Certainly, you know, with PMP and that kind of thing, really for the outpatient setting we're making an impact. In the inpatient setting, we have leapfrog and joint commission metrics where we have to reduce the number of Morgan milligram equivalents that we're dispensing, and we have to be able to show progress over time. So, I mean, it's coming at us from a lot of different angles, and yay for that. Is it quick enough? Probably not for the loved ones of those 104,280 who died. It's not.
And now that, you know, the generics going out, it should be cheaper. I mean, personally, I think PPM should pay for it 100%, but that would be my personal opinion, not the board's.
Well, and I mean, that's exactly the reason there was
Yeah.
discussion about getting the other stakeholders in the room and including payers in these discussions and that kind of thing, because it is.
I'll give you another opportunity for next year. It's a little late this year, but there is the Utah School for Drug Addiction. Is normally the first week in June, and APHA sponsors that, and they love for board members to come to that. We're actually sending two of Megan's team this year. Mary Martha Murphy and Ray Moretti are going to spend the first week in June in Utah in that school. But if any of you are interested next year, if you will put it on my radar screen when I get that announcement. It's really a pretty affordable opportunity, and it's a really neat opportunity to go and spend a week with lots of pharmacists and pharmacy students. You'll see pharmacy students like you've never seen before, energized and excited about the future and what they can do in the drug addiction arena. So
It's
just
the 1st of June?
first week in June.
Is it in Salt Lake?
And just to add, Raquel Leal, who is our director of PRN, she will be attending this year as well.
About that.
So let's, for the next newsletter, I think that's a really good idea. Let's get a reminder in there about,
The newsletter queen is listed.
I know, the standing order and,
We'll send you a blurb.
yeah, a blurb. That was gonna say, we need to write a little blurb to go with it.
Thanks, Lori.
Yes, thank you again.
Thank
Thank you
you
for
for the
going.
opportunity. I enjoyed it.
All right, next on our agenda, we will go to Miss Caroline.
Okay. So we're at G.1. This is your report on your closed complaints. The first page is going to be as of the end of the current fiscal year, no, current quarter of the last fiscal year that we're in. So as of February, so we have the year-to-date of the complaints and how they were closed for running total for this year. And the bottom of the chart is going to be a comparison of those closed with disciplinary action to those closed with some other type of disposition. And on the second page of the complaint is historical data looking at the quarterly average for the prior fiscal year to the current quarter numbers as of the end of February with how that's trending for this year. And then the same thing for that bottom chart is the complaints closed with disposition other than disciplinary and disciplinary. And once you've looked at that, then on G.2 is your open complaints. So these are the age of your open complaints and the number of open complaints that you have. The top part, again, is just historical. Chart 2 is as of April 18th. Those were your open complaints, and then they're categorized by their age.
I love to see all those negative numbers. Any questions?
Caroline, where do you put in here when they have a solo complaint and they, is it listed somewhere?
Yeah, so that is going to be, if you're looking, Donnie, at the back on your closed complaints, that's G.1.
Okay.
So those are going to be all of your, anything resulting in disciplinary action. So if they're a board order, that could be as a result of the default or following a contested case hearing.
Okay, that's what I was trying to figure.
So that's where you're looking at
Okay.
in particular.
How did we put that on?
For the board order?
Yeah.
Yeah, we could do, we'd have to look into that for you,
I was just
Rick,
wondering
and see.
because, 2020 was when we shut down, so I didn't know more complaints were happening.
Oh, I see, just in general, like all complaints. So that would, probably the closest more complaints
G.2.
received. So in G.2, in G.2, those are gonna be the number of complaints that the board received. So that's gonna be better statistic there. So you can kind of see that. So in 2020, when things shut down and there wasn't a lot of activity, you do have a smaller number there on the number of complaints, and then it did start picking back up again in this last fiscal year in 2021.
Yeah,
So you can see it starting to rebound there. So, of course, we don't really have that for you for 22. We're still halfway through that, so we don't really quite know where we're trending for that, but it doesn't ever seem to slow down.
I recall in 2019 that we had a lot of very old ones that you cleaned up. They were stuck in a drawer somewhere or something. I do remember you got cleaned up quite a bit, so it's been a lot of good progress. And I think going to the strategic plan that we have talked about earlier, this is one of the action items is to resolve everything pretty quickly. Complaints 180 days and other things really quick. So you're well within the strategic plan that the board is setting out. So appreciate that.
She and her team do an amazing job, and they go unnoticed. So, in front of the board, I'd like to say thank you to Caroline and her team.
Absolutely.
She has great people inside and outside that do great work, and she gets frustrated with me at times, but she works with me, and she's doing fantastic, and I'm very proud of that whole team.
Yeah, and to Rick, both Rick's points, if you look at FY19 and FY 2021, they're not appreciably different. So that 11% up from 2020 maybe is more in line with what we're seeing. But on the flip side to Rick Fernandez is you can see that every year since 2019, the length that it's taken to close things has gotten shorter and shorter. So yeah, huge improvements in the group, and the team does a great job. Any other questions, comments? Well, Ms. Caroline, thank you so much. All right, the only thing we have left is kind of our miscellaneous. you know, the first thing would be, you know, obviously our next meeting is August the 2nd. So wanted to see if you currently have any items that you would like to be put on the agenda.
Would that be, that one, would that be a reasonable time to bring up that conversation around Schedule C?
Totally up to you, sir.
I'd like to bring up the conversation on Schedule C.
We can bring you
on
some,
Schedule C. I thought you were.
we can
okay,
bring you
yeah.
back some facts and figures
Yeah.
and
Yeah.
details about Schedule C, just so the whole board will
Is
know what
familiar with
Schedule
it.
C is
Yeah.
and what that means.
Yeah,
Thank
and how
you.
that may impact the budget and everything. That is good.
Not by mistake.
I thought you were looking for something in the schedule, and I'm like, what? Any other items?
I just want to clarify that those non-sterile compounding rules will come back in August.
Yeah, it'll be on the approved, yeah, that's an automatic. There's not anything that we need to do on that.
And they will have already been posted for copy.
Yes.
Yes.
Yes, they will have gone to the registrar and everything. Any other? All right, so, yes, yep, yes. Okay, so as we go through the list, I wanna make sure everybody's kind of got everything on their calendars. And we'll ask Lily to send out, once again, the informal, who's on what informal conference, just to put it on, you know, make sure it's on everybody's mind. So, our next informal conference is May 17th. As stated earlier, Rick and I will be at NEBP the 19th through the 21st. And then we have informal conferences set for June 7th through the 9th, June 28th, and then July 6th through the 7th. Our next board meeting is August the 2nd. Tentatively, because we know we're all flexible, don't know everything written in stone, is that meeting will be here. I want everyone to etch it in your calendars, because we are going to take a picture. We have to take a picture. Ian is not in our picture, and neither is Tim. I forgot about that. We need to get our current picture done, so we will. Yeah, we'll crop everybody in there. So I want to make sure everybody's here for August the 2nd. We will look at either doing a picture maybe in front of the new building or over in front of the federal courthouse. Possibly or most likely someplace other than this building. There's not anything pretty left in this building, and we want to get a good picture of everybody in there. The other date to make sure you put on your calendar is that move date of the 17th. The staff does an exceedingly great job for us and for the state. Anybody that's moved an office, it is a stressful thing. It's not fun. Let's be good servants and be there for the staff. I mean, even if we're just there to move one box from one place to the other, just for that moral support, if you can be there on that day, it's the September 17th.
September.
And it's a Saturday. Be flexible. We don't know what'll occur with the building, but I would just ask you, I mean, y'all all have a servant's heart, or you would not be here serving the citizens of the state of Texas. But let's have servants' hearts and really support our staff. They deserve that, and like I said, moving an office can be, even if it's just down the street, can be really stressful. So let's give them our moral support as well as schlepping boxes. So we're gonna have the schlepping box day. With that, I will ask, is there any other items that we need to discuss? Seeing none, I will ask for a motion to adjourn.
I make a motion to adjourn.
Second.
Donnie has made the motion to adjourn, and Daniel has seconded. All in favor?
Aye.
Any opposed? Thank you all for your service today and your active participation.
Hey, by the way.